So your doctor has told you you have multiple levels of spinal disc injury, multiple nerves injured, and you've got pain either in your back, down your leg, you've got numbness and tingling. How do we know which disc, which nerve is the culprit to fix in order to get rid of your back pain, your leg pain, and your leg numbness? In this episode, I am going to teach you exactly how to determine that. Let's see what happens next. Hey gang, I'm Dr. Jeff, your advanced trained, non-surgical spine and disc specialist and chiropractic veteran of 21 years and counting. I've been working with the spine for 21 years. We've helped over 2,000 discs heal non-surgically in the last 3.5 years. I trademarked a technique called the Diagnose method. We know disc, we know spine, and in today's episode, I want to share with you how to determine which level in your back, which level in your leg, which nerve, which disc, which is the culprit. Because we, in our practice, we do not treat images, meaning every single new patient in our office has a set of x-rays, and if we think it's a disc injury, has an MRI. Why? Because the MRI is the gold standard to seeing disc injury and nerve injury. So in our office, we listen to a patient's history and we determine exactly where their pain is in their back and in their leg. Let's talk about the low back. You have 5 discs in the low back. What is a disc? Well, that's a bone, that's a disc, that's a bone. You have 5 of these discs, which are cushiony water balloons, and you've got nerves that come out of each level, and you've got nerves that run down the center in between the bones. So when a patient comes in and says, I've got X, and we think you've got a disc injury, we send for an MRI. We study our own MRIs, and then we match up where they feel the pain either in their back, leg, and we match it up to where they feel it. We match it up to the MRI, and we treat the person, not the image. I've had too many patients come to me saying, man, my MRI was a disaster. I had this surgery, I had that fusion, and I'm still in pain. That's because most of the doctors will treat the image. In today's video, I'm going to share with you how to determine which level is the culprit. Which disc, which nerve is the culprit? Because let's put it this way. There's 5 discs in the low back. Let's put 5 little kids in front of us and all of them are screaming, wah, wah, wah. But one, wah, is screaming the loudest. And that is the one you want to focus on first. That is the one that brought you into the office. That is the one that's changing your life and altering it, and that's the one you want to focus on first. So let's spend the next few minutes discovering which level causes which in your back and which level causes which in your leg. So the L1 disc sits in between the L1 and L2 bone. That's the L1 disc. When this herniates, bulges, tears, or becomes decayed, you will have disc pain called discogenic pain along the spine just under the rib cage. So your back pain will be kind of high just under the rib cage. And if you pinch the L1 nerve at this level, you will have upper groin pain on whichever side the nerve is pinched. If you pinch the L2 nerve at this level, you again will have upper groin pain. At the L2, L3 disc, the L2 disc between the L2 and L3 is damaged. You will have discogenic pain or pain in the back, again, just below the rib cage. It's going to be kind of high. Again, if you damage the L2 nerve at this level, you're going to have pain, upper thigh, upper groin. L2, L3, upper. L3, L4, lumbar 3, lumbar 4, lumbar 3 disc. If this disc is damaged, you will have discogenic pain, typically halfway between the top of where your belt line would be and the bottom of your rib cage. So if you put a hand on the top of the belt line, bottom of the rib cage, halfway in between. So your back pain is going to kind of be in the middle of your low back. And if you pinch the L3 nerve, you're going to have pain, numbness, tingling, burning, halfway, put a halfway point on your front part of your thigh up. Halfway. So you'd only go down halfway on your thigh, and that's the L3 area where you would have pain, numbness, tingling, or burning. L4, L5. L4 bone, L5 bone, L4 disc. If this disc is damaged, you will have discogenic pain at the belt line, or what we call the sacroiliac joint line. the belt line, the top of your hip where you'd wear your belt in your back. And if you were to have leg symptoms, it would be the halfway down, halfway in the thigh in the front to the knee, the inside part of the knee, the inside part of your calf, the inside part of your big toe. And finally, the L5-S1 disc and nerve. If you were to have an L5-S1, L5-S1, S1 is down near the tailbone, the L5 disc, you would affect the disc pain would be below the belt line, like real low, just above your rear end crack. You'd say, man, my pain is low. That'd be discogenic spine pain. If you were to affect the L5 nerve, you would have side of your rear end pain, outside part of your thigh pain. It would wrap around to the front part of the knee, go to the top part of the shin, front part of the shin, top part of the middle foot, and then bottom part of the middle foot. And the S1 nerve can also be affected at the L5-S1 disc in the central canal, we call it. That pain is going to be in the back of the rear end, back of the thigh, back of the calf, and outside part of the foot. So gang, if you have low back pain and leg symptoms, and your doctor has told you that your MRI is filled with disc problems and facet arthritis and lots of inflammation, and he wants to treat it all, you need to identify which is the most important level to start with. Remember, 5 little kids there, wah, 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 and one is screaming the loudest, wah! Focus on that one first, because when we focus on that one first, the pain levels will come down quite a bit, and typically we can solve the problem with that. I'm Dr. Jeff, your advanced trained non-surgical spine and disc specialist, as well as your chiropractic veteran of 21 years. We help serious spine and disc cases that no one else helps. We're located here in Northeast Indiana, just about 50 minutes east of Notre Dame. The name of my clinic is the Midwest Disc Clinic. I also wrote this simple little book here, Never Look Back, a simple guide to the causes and care for back pain. We teach you what's causing the back pain, how to actually help your doctor diagnose it. If he's not diagnosing it quickly and you're waiting for insurance and waiting for this, get to a doctor who knows how to diagnose it so you know what's going on so you get self-fixed quickly. We talk about the 5 ways people unknowingly hurt their necks and backs and the 5 ways to prevent it daily. And then I give you a little technique that I developed on how to help spinal disc injuries non-surgically with a 90% success rate. I'm Dr. Jeff. I hope this video helped you out. I hope you go back to your doctor and say, I think it's the L3. We go to the L3 MRI and there it is, because that will save you from tons of headache and surgery. I'm Dr. Jeff, your advanced trained non-surgical spine and disc specialist and chiropractic veteran of 21 years, author of Never Look Back, because when you get out of back and neck pain, praise God, you never want to look back. Have an awesome day.